KQKI News, I'm Brady Borrell. Good afternoon. I am with Dr. William Cefalu Jr. He is the chairman of the Hospital Service District number 2 here in St. Mary Parish. Last night, the Hospital Service District met by teleconference, of course, due to social distancing. And Dr. Cefalu, when they have these meetings, he gives a chairman's report. However, because it was not a public meeting due to the social distancing, they reached out to us, and we wanted to share that chairman's report with you to give the community an idea of what Oxnard St. Mary is doing to help mitigate the issues with the coronavirus here in St. Mary Parish. So, Dr. Cefalu, thank you for meeting with us. If you can give us an idea of what is happening at Oxnard St. Mary and with the Hospital Service District.
Sure. Good to be with you, Brady. How's everyone doing? Hopefully everyone's staying safe out there and adhering to the recommendation by state and local officials to stay home if you can. An update on our meeting yesterday. We had a very good meeting. The biggest thing to come from the meeting that I think people need to be aware of is that the Hospital Service District has authorized the purchase of 5 ventilators for Oxnard St. Mary. Those ventilators were purchased through Oxnard. We utilize Oxnard's purchasing power to obtain those ventilators. The PO has been placed. They are not here yet, but we anticipate that they will be here shortly, and they will be dedicated to our facility. As you know, we're now part of the Oxnard family, and they have made procurements of ventilators and equipment as well, based out of New Orleans. But we wanted to ensure, as a hospital service district, that St. Mary Parish had what it needed to adequately care for any potential patients who were critically ill from coronavirus. So those 5 ventilators were purchased at a cost of a little over $200,000. But what that will allow us to do here locally is ensure that all 8 rooms in our ICU will have ventilator capability. So if someone does get critically ill, we will be able to utilize our ICU to its full capacity for patients who need ventilator assistance.
Now, officially from the Department of Health and Hospitals, as of yesterday at noon, they have reported 5 cases. The report just came out just moments ago. They're not showing any more cases on their end, but you're confident that our numbers will go up in St. Mary Parish.
Yes, the numbers are going to go up. The nature of this virus and how easily it's transmitted will basically ensures that we're going to see more cases. I've been in touch with local officials, the coroner's office, etc., and we're anticipating our local surge, so to speak, within a week or two, and I believe that to be accurate. Just as there are no reported cases in some parishes, I can guarantee you they're there. We're just getting to a point now to where we're really opening up testing. Testing has been a rate limiting step for us. We just haven't had the capabilities, especially in offices, to perform the number of tests needed to really truly screen for the disease. So that in and of itself is going to bring our case rate up quite a bit. So yes, we are on the cusp, I believe, locally of seeing a surge in cases, and we need to be prepared for it.
Moments ago, the numbers came out, as I mentioned. We have now eclipsed the 2,000 mark in Louisiana, 2,037 cases in 48 of the 64 parishes, 65 deaths, unfortunately. As a matter of fact, I'm sorry, those numbers were 83 deaths. We're looking at some different numbers now. 83 deaths, and of course, it's impacting St. Mary Parish. Thankfully, no deaths reported, but we just have to take the precautions.
Yeah, it cannot be overstated how important it is to adhere to what policies have been put in place from state and local officials. Stay at home. If you do not need to be out and about, please do not leave your home. What we're concerned about as your medical providers is that this huge surge in patients that are going to need aggressive respiratory care. And any system in general, any system on planet Earth would be overwhelmed if we do not blunt this curve, if we do not taper it down to where the cases that do come in at a steady pace that we can accommodate. So again, it cannot be overstated. Social distancing, stay home, check on elderly, check on family members who have comorbid conditions. We have a high rate of smoking, obesity, cardiovascular disease in this community. We are at higher risk than other communities. I would say we're probably on par with New Orleans as far as risk factors, but we are a higher risk group. And so we need to be very diligent about protecting our elderly and our at-risk population.
And to clarify, those numbers that just came out about 10 minutes ago, 2,305 cases in Louisiana, 83 deaths, 53 of 64 parishes it's impacting. So obviously it's spreading. The numbers are alarming. So we just, as he said, we've got to keep that social distancing. In other ways, the hospital is preparing. What about staffing numbers? How do we fare with that?
So, well, first I'll talk about some mitigation measures that we're instituting at the facility, and then we'll talk about staffing and kind of what our capabilities are. Right now, the hospital, Oxner Systems statewide, has instituted a no visitor policy. So we're not allowing visitors unless it's absolutely necessary for people to come into the facility to prevent that spread. We have closed all entrances except for the main entrance, at which point in time everyone is checked for a temperature. And all of our employees are offered, all the employees of the hospital are offered a mask to wear while working. We have the personal protective equipment that we need at the facility now. We are already instituting measures to prolong its use. We are reusing masks for the same patients and things such as that. In anticipation of a surge, we want to make sure that we have plenty of supplies. Oxner has a stockpile of not just ventilators, but personal protective equipment in New Orleans that they will distribute on an as-needed basis. So having that partnership with Oxner is going to be very helpful, especially in this type of situation. So multiple mitigation measures are in place currently. As far as staffing, we're actually right now as ready as we can be. The hospital, thank goodness, currently is at a capacity of about 20 some odd patients. We can ramp up and have enough staffing to take care of 50, 60 patients, but we're stretched out pretty thin then. So we are capable of ramping up quite a bit. The limiting factor for our facility is going to be staffing and is going to be ventilators, which is why the hospital service district pursued procurement of 5 additional ventilators for that purpose. So we're fortunate to have a large building, and we can certainly accommodate much more than that if we had the staffing to do so. But we have on hand currently a total of 22, we'll have 22 ventilators. Now that's the high quality ventilators that we currently are using in addition to some emergency backup type ventilator systems. And that will allow us, if you crunch the numbers, if you assume that about 20% of hospitalized patients with this disease will require one of those ventilators, if we in St. Mary Parish get to a number of around 400 contracting the disease, all of those ventilators will be utilized. So we cannot stress the importance of ensuring that we do not get hit as your medical providers, as your healthcare system, a huge onslaught of patients who are ill from this disease, especially given how delicate a lot of our elderly and patients with comorbidities are here locally. So I would stress again, please adhere to the stay-at-home policies. Please adhere to social distancing. Wash your hands, good hygiene, and if you're sick, stay home. I'm encouraging especially younger people with good immune systems who are coming in with mild upper respiratory symptoms. We're still trying to screen those patients, but they need to assume they have it. They need to stay away. They need to wear a mask when they're around others. They need to self-quarantine to ensure that they're not constantly spreading this around town because they feel fine. And that's the false sense of security with this disease. We have to assume that everyone, even with mild symptoms, has it. We have to prevent this huge that no hospital system could handle.